Coming to you today from inside our compounding lab at Dakota PrecisionRx Labs. As many of you may or may not know, a large part of our compounding practice is dedicated toward working with veterinarians, treating companion animals, and some of the things that they need help with. We have two areas that are very unique that I'd like to demonstrate to you today. These are gels. They're made from what's called a thermoreversible base. So when it's cold, it flows. It's like water. As it warms up, it gels up solid. So I'm going to demonstrate what we might do for a dog with a chronic ear infection. One of the things that's important to know is our ear canal is straight to the eardrum. A dog's ear canal is a drop down and then it flattens out. Oftentimes that infection is in this flat area, and if we're trying to do drops or an ointment, we don't get there. So as you're going to see in the demonstration, this gel, when it's cold, will flow slowly down through here. And then it's solid and it adheres to the tissue, so it creates almost a chocolate Easter bunny effect, where the medicated gel is against the tissue. The dogs aren't bothered by it because it hollows out, so it doesn't plug their ear. So it's a really, really cool gel. So I'm going to demonstrate this first. It's a refrigerated product, so I'm going to go grab it. Typically, we compound these, an anti-infective, an antifungal, maybe a steroid. We put them in a bottle, shaken up to disperse the drug, draw it out with the dosing syringe. So I'm going to demonstrate how these ear gels work. We oftentimes put an anti-infective, an antifungal, maybe a steroid. This is a liquid gel because it's cold, which I just took out of the fridge. I have a little tube in here, and this is colored. So as I drop this into this tube, you're going to see how that flows all the way down. So really, what you're doing is you're going to take this medication, you're going to draw it out of a full prescription bottle. You're going to drop that syringe at the top of the ear, getting it down a little bit so it's comfortable. And then as you're pushing that gel, you're going to see how it flows down, right down to the ear canal. So we have filled that canal completely with the medication. And as I mentioned before, as it warms up, and I'll demonstrate that in the next thing, that gel sets up and it becomes solid. Gravitates to the tissue, creates that hollow effect. So you have to hold their head a little bit because they can shake it out when it's liquid, but 30 seconds, it's gonna solidify. Then you've got a medicated gel that stays in there and really works for almost a week. And sometimes I've seen really bad infections clear up with 2 treatments, which is very unusual. This is a fabulous delivery system.